Hey everyone, and welcome. I am absolutely thrilled to have you here today. If you're looking to conquer the latest manual changes and really elevate your coding accuracy, well, you are in the exact right place. Today's explainer is entirely dedicated to mastering the brand new, highly specific ICD-10-PCS updates that you're going to encounter on your exams and, of course, out in the field.
Now, I just want to take a quick second to acknowledge the hard work you're putting in. Let's be real here. Keeping up with these dense, alphanumeric coding changes year after year, it can be incredibly challenging. The manuals update, the tech evolves, and suddenly you're staring at a whole new set of tables and qualifiers. But hey, don't worry, we're going to break these updates down visually so they actually make sense and, more importantly, stick in your memory.
So here's our roadmap for today. 1. Conquering new PCS updates. 2. Heart failure and the WhiteSwell system. 3. Coding the WhiteSwell procedure. 4. Eye imaging, specifically Fluorescein angiography. And 5. Coding Fluorescein angiography. We'll be using our tried-and-true problem-solution translation method to help you ace those exams.
All right, Section 1. Conquering new PCS updates, bridging clinical reality, and coding mechanics. Let's dive right in.
Moving right along to Section 2. Heart failure, WhiteSwell, system, a breakthrough solution.
Okay, so to bridge that gap between clinical reality and your coding manuals, we really have to start with the specific clinical problem, which is acute decompensated heart failure. You see, the biggest mistake you can make as a coding student is trying to just blindly memorize tables without actually understanding what the physician did in the first place. The patients receiving this specific new treatment are adults suffering from severe fluid overload or congestion, and crucially, they haven't responded to standard diuretics. So the physician is dealing with a patient whose body is retaining a dangerous amount of fluid and traditional meds are just failing. Grasping this severe fluid congestion is totally key to understanding why this upcoming surgical intervention is entirely necessary.
Let's walk through the surgical insertion logically so you can really visualize the operative report you'll be coding from. First up, the physician administers local anesthesia. Second, they utilize both ultrasound and fluoroscopic guidance to navigate. And third, and this is the vital part for your coding path, they place the device specifically in the innominate vein, which is located in the neck. Really picture that workflow in your head, because those specific clinical details are exactly what's going to dictate our body part and approach values later on.
So what is this device actually doing once it's sitting there in the neck? It's called the WhiteSwell eLym system. And honestly, this brilliantly illustrates modern medical tech. The system uses an impeller pump to create a lower pressure zone. Think of this lower pressure like a giant vacuum. It actively draws built-up lymph fluid out from the interstitial space and pulls it safely right into the intravascular space so the body can naturally manage it. And get this pump can remain perfectly in place, actively decompressing that fluid for up to 60 hours of continuous treatment. Pretty amazing, right?
I also just want to point out that this isn't some everyday tool. The WhiteSwell eLym system was officially granted Breakthrough Device designation by the FDA. Highlighting this impressive designation really underscores the cutting-edge nature of the procedure you're learning to code today.
All right, Section 3. Coding the WhiteSwell procedure, translating tech to PCS. Let's see how this maps out.
Now, what's really interesting here is that this procedure actually requires two separate codes. First up is the insertion of the device, which brings us to table X2H. Let's mentally chunk this insertion code together. Based on the operative report we just visualized, your body part value is 4 for the left innominate vein. The approach value is 3 for percutaneous, since they used a puncture with imaging guidance rather than making a massive open incision. And finally, your device or technology value is M, which specifically stands for Temporary Intraluminal Device Venous Angle Decompression using impeller pump. See how all those clinical details map perfectly to these alphanumeric characters?
But we aren't quite done. The second code captures the actual work the pump is doing. This takes us to the extracorporeal or systemic assistance and performance section, specifically Table 5A0. Here, your body system value is 5 for circulatory. The duration value is 2 for continuous. And here is the big update for your exams. Pay close attention to the function value. You are going to use the brand new value 7, which stands for decompression. This is a newly added row created exclusively for this very function, and it's paired with the qualifier value D, which represents the impeller pump. Quick timeout. Before we jump into the next major update, if you're finding this breakdown helpful, please drop a like on this explainer and make absolutely sure you subscribe to my YouTube channel. Seriously, subscribing is your absolute best tool for daily study success. I post daily coding updates just like this to keep you sharp, informed, and totally ready for your exams. So go ahead, hit that subscribe button, and let's keep the momentum going. Section 4. Eye imaging, fluorescein angiography, visualizing blood flow.
First off, what is the clinical purpose here? Well, fluorescein angiography is designed to help the physician assess the anatomy, physiology, and pathology of blood circulation inside the eye. Specifically, we're looking at the blood flow within the retina and the choroid. Just as a quick anatomical refresher, the choroid is that pigmented vascular layer of the eyeball situated right between the retina and the sclera. So that is our precise anatomical target.
To really grasp this update, you've got to understand how this differs from traditional imaging. When you hear the word angiography, you might instantly think of traditional X-rays using ionizing radiation. But actually, fluorescein angiography is completely different. It relies entirely on light stimulation to make the blood vessels literally glow for rapid photography. That means this is a completely radiation-free eye test, which is a really crucial clinical distinction to keep in mind when you're navigating your imaging tables.
When you're reading an eye imaging operative report, here are the exact keywords you should be scanning for. For the injectable fluorescent dye, look for FDA-approved brand names like Fluorescein or AK-FLUOR. For the rapid photography equipment, you want to look for special ophthalmic camera names like the Sentinel camera by AI Optics or the Clara 700 by Zeiss Meditech. Spotting these specific terms confirms, for sure, that you are looking at a fluorescein angiography.
Section 5. Coding fluorescein angiography, navigating table B85.
So the crucial point is knowing exactly where to map these glowing dyes in your manuals. Let's break down the newly created table B85 under Imaging, Eye, Other Imaging. This table was created specifically for this light-based procedure, and it features a single, highly specific row. For your body part values, you'll use A or B for the choroid and G or H for the retinal vessel, depending on laterality. Your contrast value is 2. And this is really the linchpin of the code. It specifically maps to that fluorescing agent we just talked about. Finally, your qualifier value is Z for none. By matching the specific body part to the fluorescing agent contrast, boom, you've successfully coded the new procedure.
So think about what we covered today. We've gone from traditional surgical tools to vacuum-like impeller pumps drawing out lymph fluid and glowing fluorescent dyes replacing radiation in eye exams. The technology is advancing at lightning speed. As medical tech evolves from scalpels to glowing dyes and impeller pumps, how will our coding systems adapt next? It's a fascinating time to be in this profession. Keep studying, keep asking questions, and I will see you on the next explainer.